This is Pathway to Health with Dr. Krygier.
Hello and welcome to Pathway to Health. My name is Randy Nunez and we're here today to learn about our health. And to help us learn about our health is Dr. Michael Krygier. So Dr. Krygier, can you tell us a little bit about your practice?
Well, I'm located in Novi, and if you want any additional information, you can go to my webpage. It's www.drkrygier.com, and all my philosophies and everything we're going to talk about today will have a lot of that information on, so you can refer to that after the show if you have any questions.
Okay, so give us a little bit of information about your background.
Well, the biggest thing about the profession that I'm in is I was a patient before I was a doctor. So I grew up with a lot of asthma and allergies, been to a lot of doctors, been on a lot of, had a lot of issues with my health that I think steered me toward, continuing my profession, or actually getting into my profession as being a doctor to help people. So I had chronic ear infections. I've had 3 sets of tubes put in my ears. I've had a lot of allergy, issues. So I think those issues and, the monotony of having these conditions kind of get you thinking, hey, is there something else you can do with your health? Is there other causes that we're not looking at? Why does this keep on reoccurring? Why do I keep on getting chronic ear infections? So that was a major issue that kind of pushed me into health. Because when you just kind of experience it all the time, of your health conditions and where you're at in life. I mean, everybody wants a good quality, of health. So I decided to go to chiropractic school. And I graduated from chiropractic school, and I also graduated with a nutrition degree. So I like to apply in my office chiropractic and nutrition. Not shortly after I graduated and I got into practice did I pick up and start taking classes in herbal therapy, phytotherapy. So that has been a real eye-opener for me and for helping my patients in the office. So I do have a DC degree, which is Doctor of Chiropractic. I do have a nutrition degree, and I do use herbals in my office.
Okay. So you started out with some of the ailments that you had in your life. So can you explain more about what some of the key philosophies you have about health?
Some of the I'm a big, strong believer in science-based medicine. I mean, I like to look at the research. I like to apply it, as I do in my own life. I think there's a lot of guesswork out there on, and everybody's got a lot of opinions. But I think the research kind of divides what you should be doing and how it should be applied in a clinical setting. So I believe that, growing up, I played a lot of hockey. So the concept of structure and function were a big issue in my life. Because, I mean, you get hit,
right.
Your shoulder goes out or your back goes out or maybe your neck's sore after a game. So I've always seen chiropractors after my sports, games if I needed to and there was an issue. So that was just my way of thinking because it made sense to me.
What about nutrition? How do you think nutrition plays a role in your health? Obviously, people think it's important, but how important is it in today's environment?
I think nutrition is one of the most overlooked issues in America, especially in America, with drugs and surgery are always first, but nutrition has a powerful influence on people because nutrition actually interacts with your genes. It actually controls gene repair, controls detoxification, controls how you metabolize, how you function in everyday life. So it's a very complex subject, but the more you break it down and the more you look at diet, you're going to see that there's more of a connection with your health and nutrition.
So do you think obviously there's a lot of things that we could put in our diet. How much of our diet today is really nutritional based versus maybe based on taste or things like that?
Well, I think, you know, mostly they say that right now 90% a lot of the issues that we go through have to do with our diet. There's probably maybe 10, at the most 15% where, you know what, this is the way you were born, this is what you have to deal with, this is the cards you were dealt. On the other hand, 90% is a major factor because there's a lot of things you can do to change on your own, and that 90% tells me that you have a responsibility and you have a accountability to what you're doing and how your health is going to turn out.
So it's not just leaving it up to the doctors to decide what your health should be. You need to take a little responsibility and ownership and to understand how your body works so you can properly nutritionalize it.
Right. Absolutely. And I'm here to kind of guide the patients and give them my experiences, give them what I learned, give them my lectures, and try to give them as much knowledge as they can, because I think knowledge is really lacking out there when it comes to applying nutrition to the public.
So as you talked before about people taking approach perhaps drugs and surgery first, what are some of the things that the medical industry should be doing differently in terms of how they treat patients?
Well, I think, I think one of the most important things is that you have to look at biochemical individuality. You can't put in the drug industry, they have the 50% curve, where people in the front might not respond to the drug, people in the middle probably will, and then people at the end probably won't. So you got a big skew there of people that won't respond and some that do, but it goes back to how the body, your unique body or your body metabolizes things. And I think that's important to note because I might only need 5 milligrams of thiamine, which is B1 every day. You might need 20 or 30 milligrams of thiamine. So there's a difference between how our bodies pick and choose based on our genes and based on your unique biochemical individuality.
So we're the same, but we're different.
Right. So we might have the same characteristics, but we express those in different ways, and that's what a lot of this nutrient environment gene interaction is.
Okay.
Another thing I'd like to approach is that I think the best thing we could do, I think there's a lot of over marketing out there for drugs, and I think that we should stop dressing up a lot of these drugs and these medications to make them look like they're the only thing and they're the thing we should look to. Yeah, in certain scenarios, yes, but it's kind of like having a fire in a fireplace.
Okay.
There's nothing wrong with that fire in that fireplace, but that fire starts burning outside of that fireplace, it's a problem. So medicine within its own realm is okay in an emergency situation, but yet people are taking on an emergency situation and they're outside that medicine realm, and they're ended up having side effects and hurting themselves.
Yeah, I find it interesting that there are commercials on television to the general public about various drugs. I'm kind of confused at why it's being marketed to individuals versus just doctors themselves. Isn't that kind of, I think we're one of 2 countries that allow that kind of advertising on television. Just recently they released some information that says that, a lot of these, there's a term called ghost authoring. And what happens is PR firms are hired to ghost write, research and put it out so that it's favorable to the public, but yet it's not the real research, it's all marketing, and that's given a false impression and a false sense of security on the public for drugs to be used more often than they really should be. And they're saying now that it's been filling up to almost 80% of the prestigious journals now over the past 10 years. So we don't know what's true and we don't know what's false. Well, that's unfortunate. So it leaves the consumer in a bewildering maze of what information should I be paying attention to, what I should be paying attention to. Well, give us an example of some of the tools you use in your office to assess health of the patient or diagnosed.
You know, the biggest thing, obviously, like we talked about, 10% you can't change. So family history is important. Where you came from, you know, what type of problems your mom and dad had, or, you know, maybe you're adopted, you don't have a family history. So you got to look at those things. Physical appearance is a big issue. I mean, you know, I believe that good doctors can look at people, pick up on physical appearance. Maybe it's the color of their eyes, maybe it's their nails, maybe it's the skin, maybe it's the hair, tongue. You know, there's all kinds of things to look at. You know, you can, but physical appearance is a big issue that, you know, you could pick up a lot of information. In the office, I use a technique called contact reflex analysis, which is usually, what it does is it's a form of muscle testing that you apply. You check the patient by muscle testing, and you check different energy patterns in the body to find out if an organ, tissue, or gland is weak, and then you apply nutrition to that. So that's my more, you know, walk in the office, do that test. Now, my next technology that I use to assess people more for chronic conditions is the Acera testing technology, which, you know, basically uses a frequency library, and it actually challenges your nervous system to find out where there's energy changes in certain systems, and then you can look at a pattern and target where you want to jump in and help the patient.
Are these procedures invasive? Do they hurt?
These are all non-invasive procedures. An invasive procedure that I would use in the office would be blood work. You know, obviously we do X-rays to check, you know, the spine for chiropractic, and then we do use thermoscan, which is that has to do with a lot of the breast cancer issues out there and women's health for preventing breast cancer. Thermoscan is a great tool to use, and it has a lot of good research to show that it contributes to preventing breast cancer by just checking the metabolic processes of the breast to see if there's any type of vascular changes there, and you might be able to get ahead of you know, an issue.
Is that done in your office, or is that done by an outside company?
We do that periodically out of our office at certain times during the year, and if it's not available there, we can always you know, refer out and use that tool.
And it's sort of almost a heat scan of the body?
It's a heat scan. Usually we use it in females, and you scan the you know, the breasts, and you find out what the difference is, where there's a heat change or a difference in pattern, and that tells you that there's a metabolic, you know, issue, or metabolically tells us that there's activity at that site within the breast tissue.
So it doesn't say this is wrong, it just says it's different.
Right, it just says, hey, there's something going on there. You know, there could be something going on there. We don't know, but it gives you a little, it lets you allow you to see if there was a net trap there, and you could see that trap, so you don't walk into it. So it makes you become more proactive.
Okay. And the blood work, do you do the blood work in the office, or you have
blood work's ordered in the office, and then it's sent. We send you to a location that you can have that done.
You do the blood draw.
Yeah. And the last tool that we use that I think a lot of people don't know about is hair analysis.
Okay.
Hair analysis is a fabulous tool. They use it in forensics, and why not use it when you're alive?
Use it for drug testing.
They use it for drug testing. But the thing we're looking at for hair analysis is a lot of people don't realize that there could be occupational issues. They could be working with chemicals. They could be involved with certain situations where they get exposed, or maybe they're in a chronic exposure. So hair analysis gives us 5 metals: aluminum, cadmium, arsenic, mercury, and lead.
So the actual metals that might be in your body could get excreted through your hair as well.
Your hair, and then you could test that and then this will give you an assessment so that you could say, hey, you know what? You might want to be on this detoxification program, or you might want to do this to get rid of that.
Okay. So talk about some of the really chronic health issues that are being faced by us today, the ones that you're seeing.
Well, the first chronic health issue that I see is cancer. Cancer is number one. Number two is your heart disease.
Okay.
And then number three is medicine itself. And then number four is diabetes.
Okay.
So the main one I see, first of all, cancer. Cancer, you know, we like to use, chemo and radiation and surgery, and there's great times when you use radiation and surgery, but chemotherapy is probably one of the, I believe, there's better ways to do it, and it only has about a 9% success rate.
Really?
But alone, not even doing any of those treatments, being on a nutritional program alone could really help your body change the physiology of your body, change your gene patterns. So I believe cancer of the future and going after this type of health condition is gene patterns with nutrition, knowing how the body specifically detoxifies, knowing how the body metabolizes. So applying nutrition in that scenario or that realm is very powerful to overcoming a chronic health condition. Okay. Heart disease is the second leading cause of death. There was a study done in the Journal of Circulation by a Dr. Culler, and what he found was he wanted to look at, there were 326 patients that he looked at, and over a 6-month period that actually had heart attacks, and he wanted to find out which ones were picked up on beforehand that had a heart attack.
Oh, I see.
So they want to see if they went into the doctor's office within that 6-month period and said, hey, you know, he looked at that information and said that out of the 326 patients they looked at, almost 86 of them were not even picked up the week before they saw their doctor. Or the week after they saw their doctor and they had a heart attack.
Was it because they were asymptomatic, or the doctor didn't pick up on symptoms, or did
you know what? I don't think it's. I think it's a combination of not. We got so much good technology out there. It's a combination of, well, is my insurance company going to cover this test? So, or is it just the bare minimum of? I believe that in the future. Well, now there's a lot of early biomarkers. You can tell where if you're heading in that wrong pathway or that wrong direction to heart disease, just by knowing, you know, maybe 4 or 5 different blood markers that might not be covered by the insurance company, but they'll kind of give you a heads up and say, hey, you're going in the wrong direction.
Okay, and you said medicine was the third. Can you elaborate on that?
Yeah. I don't
Seems counterintuitive, but
well, it is, and you know, there's a lot of you know, there's a lot of side effects from medications. There's a lot of misdiagnoses. There's, you know, I believe that overall, people, you know, medicine is trying, but I just believe the medical paradigm is a little false.
Okay. What was the other one? I think you said, was it asthma?
Number four or number 5 is diabetes.
Oh, diabetes. Okay.
Diabetes, probably about 6% of the population has diabetes, and about 60 million people are actually pre-diabetic going into diabetes.
Okay.
So it's a major issue. Diabetes, I think the worst case scenario in medicine is doctors don't talk about diet and lifestyle when it comes to diabetes, and it's easily fixable if they would just talk about diet and lifestyle. There's a place for medications, but it's just too much. It's just being overused.
There's a balance there, if you will, right? Okay. So, what types of conditions that come in your office that you can help people with? What do you see?
Well, I see. I see a lot of digestive issues. It seems like the digestion has a lot to do with, the immune system. Digestion is very important. If you walk into any grocery store, there's at least 2 aisles full of medications on each side just covering digestion.
Really?
So it's a major issue. It's a simple issue. I mean, we see people from a nutritional standpoint with ulcers, with gallbladder issues, people that have GERD or gastroesophageal reflux disease. I don't believe these are medical conditions. I believe these are nutritional first and then medical if it's needed.
So is it the way we eat? Is it what we eat? What do you think's causing this?
Well, I think it's there's a lot of I think there's a lot of causes. I mean, I don't want to get into drink your water, eat your vegetables. Everybody knows that information, but a lot of people don't realize is that what medications are you taking that interact with your body?
Okay.
On a general basis. Maybe it's pain medication. Maybe you've been on pain medication and you're not fixing the problem, but that's your only solution that you think there is, but you haven't talked to an alternative doctor or another doctor that might be a good reason to focus on something else.
Well, what are some of the other conditions that come into your office?
Immune system issues, MS, people with chronic infections, you got to support the immune system. I see a lot of the heart disease issues. What do we do for heart disease? There's a program you can go on, and there's the technology that I can use to give you an insight on what's going on with heart disease. I've for the past 15 years, I've done a lot on female hormone issues, PMS, menopause, infertility. There's a lot of female hormone issues that you can help under nutrition that people can get tremendous results.
Really? So tell us about a few behaviors that we can do in our personal life that'll help us be healthier. Other than, like we said, exercise, eat right, are there some things that we do in our society that aren't healthy that we could change?
Well, I say we have to be proactive. I mean, we have to be proactive. I mean, I believe that, in our society, looking at the different, all the amount of chemicals in foods, the amount of bad fats in foods, the undernourishment of fats and proteins, the overnourishment of carbohydrates. That I think that's a major issue that needs to be addressed. But the problem is, it's one thing fits all. So maybe the biggest thing I think is getting checked by a doctor, whether it's me or another doctor, and being proactive, getting at least checked once a year. And I tell people out of my office and my patients that you should do 2 detoxification programs, 2 purification programs, one in the spring, one in the fall. The things you are trying to get rid of that you carried through the winter, and the things that you try to get rid of before you go into the winter.
Interesting. Well, what are my detoxifying, or how does that work?
It's just a program to enhance purification, get things out of the body that normally wouldn't be in the body. The body does a good job of compensating, and compensations a lot of times are good, but you can't keep on compensating. Eventually, something's going to break down. So, using a nutritional detoxification program. Going on that helps clear the liver, biliary system. It helps clean the gallbladder. It opens up your thought process. I mean, it just gets you. It's just like cleaning out your attic.
So it's basically nutritional based as opposed to some procedure that you do in the office, if you will. You take some kind of supplements or drink mixture or something like that, right?
Right. Yeah.
Okay. Give us some other behaviors that you think we could change in our lifestyle that could make us more healthy.
Some other behaviors I think would be, I would focus on, making sure, obviously you should get enough water. You should try to eat things that aren't canned, bagged, packaged, sealed. I mean, those are all the things that have the preservatives. Those are all the things.
So if it goes bad, it might be good for you. Just don't wait till it goes bad.
Right, exactly.
Okay. So the fruits and vegetables and meats that maybe aren't.
Yeah, meats, nuts, and seeds. I'm a big advocate. In my office, I always tell people, meats, nuts, seeds, and vegetables. I try not to tell them to do a lot of grains because those have a lot of the carbohydrates, the starches, a lot of autoimmune disease with that. And I tell them fruits should be snacks.
Okay. Well, with meats, are there any certain kind of meats you should stay away from? I know there are people who don't like red meat or think red meat's bad for you. What's your perspective?
I disagree with that. I think that, you know, when it comes to red meat, I think we overcook red meat.
Okay.
I think if it's a good quality red meat, I think it should be pink in the middle.
Okay.
I think one of the biggest problems we have is cooked food diseases.
Cooked food?
Cooked food diseases.
Not raw food, cooked food.
Cooked food diseases, where we're cooking especially beef. I'm not talking about, you know, chicken and eggs, but especially beef where it has a high level of carnitine in it, and it has a high level of methionine in it. A lot of those are taken out after you cook it.
Oh, really?
So, and those are huge amino acids for detoxification in the liver that are used up that the body can't replenish and can't draw off, and you're supposed to be getting your foods, you know, nutrition from your foods.
Right.
So that's another thing that makes it hard for us, and I believe that would be a proactive approach to change, you know, overcooking your foods.
So do you think with the way foods are prepared today and grown that we can get enough nutrition just from eating our food, or do we have to do other things?
I don't think so, because I think nutrition, we think nutrition is just developmental. Make sure they just get enough to eat.
Right.
I think it's getting more complex than that. They're realizing that nutrition is going to allow you to protect your nerves so that chemical doesn't interact with your nerves. You know, if nutrition protects the body. So if you got a lot of chemicals, you're not putting up those guards, and your body can't metabolize that chemical out of your body. So you're actually putting yourself at risk.
Yeah, yes, I would think if you could build up your detoxification system and your immune system, those are very powerful health protectors, if you will, more powerful than and more selective than a lot of drugs and surgery approaches. Not that you should avoid them, but it seems like we should do preventative things first rather than waiting until we have a
and
chronic problem.
I agree with you, and that's a perfect example, because in the elderly, what do? We give them flu shots.
Okay.
Give them shingles vaccines. Well, really, those vaccines have never proven to work in the first place.
Really?
So, and they think that, you know, the mortality rate, or I mean, the rate at which it helps the body adapt is not as good as they think or thought it was. I think a better approach would be to, you know, try to focus on a nutrient that will raise natural killer cells, because that's what they're trying to do anyway, is trying to get the body to learn. But if you get a nutrient or a supplement that can raise natural killer cells, you're doing the same thing as that vaccine, plus you're not getting all the additional side effects of that vaccine. Okay.
Well, where can we go to find out more information about how we can improve our health?
You know, you can go to my webpage at drkrygier.com. We're going to be doing more of these health topics, individual, selective, so we can be more specific on health issues. I have a lecture coming up at the end of January on female hormone issues at the Novi Public Library. And then go into the webpage and just, if you go to the webpage, you can sign up for my newsletter, and that newsletter will give you a lot of information how nutrition and disease are related, and give you the journals and the research, you know, so that you have a good foundation of what you're doing.
All right. Well, I think we're just about out of time. Thank you,
Okay.
Dr. Krygier, for sharing
you.
all this great information, and look forward to the next show on Pathway to Health.
Thank you.